Thank you for allowing me today to review with you what we talked about in our town hall meeting on the main campus. Financially speaking, we're halfway through the year, and I have to admit we're lagging a bit behind where we expected to be by almost $2.7 million. It does concern me, but it's not time to set your hair on fire. We have plans to correct the shortfall, and clinical volumes are our main challenge. We are working with faculty to improve our volumes, especially the inpatient volumes in our Bay Area hospitals, and to also improve volumes in certain specialty lines, such as surgery and cardiology, who both are lagging behind just a little bit. We have lost some faculty in those areas and simply must upgrade our numbers of faculty and our appointment schedules also to accommodate all the people who are calling and trying to schedule visits. My hats are really off to the primary care providers in the community-based clinics. We increased the numbers of those patients this year by 25,000 so far. I'd like to give a real shout out to the Women's and Children's Services for their work and their rebound in OB and nursery services. We had a lag there also at the very first few months of the year, and thanks to the innovative efforts of our OB staff and Dr. Joan Richardson, we came up with some changes in our delivery methodology and timing that has increased our actual volume significantly this year, resulting in a large census of new healthy babies. If we continue to perform well in our clinics and improve our surgeries and inpatient volumes, particularly in cardiology, we should come to the end of the year right on target with our budget. We will be keeping a very careful eye on that. I also provided today an update on our best care results and what actions we're taking to try and stay on top of those Vizient ratings. As you recall, we have been at the top of the Vizient rankings, at least in the top 10, for the last 3 years. And we all know that the number of people in that top tier churn or turn over significantly from year to year. We are on the downslope right now, ranking 30th out of some 100 hospitals. 30th is still up in the areas of significant improvement, considering when we started this tracking, we were ranking 76th in the nation. We would like to get back in the top 10, though, so we have some strategies in place to do that. We are doing our best effort to get back on track with the John Seeley Hospital modernization. We have had incredibly slow work going on in the hospital. It seems like if anything can go wrong, it chooses that particular project to go wrong in. As a result, we're almost 2 years behind in bringing online the major remodeled beds in the east wing of the hospital. We will be also moving immediately to the west wing of the hospital, which abuts the old UTMB Children's Hospital. If you remember, that Children's Hospital is now a testing center, so as we move into that, we have to take a change in construction methodology and timing to not disrupt student tests for the schools of medicine, the PA school, and also the schools of nursing and allied health sciences. What we'll be doing is having our construction teams start earlier in the day and knock off earlier and forego the cost of moving the testing center, which would be some $2 million. Therefore, testing for our students will occur in the afternoons and evenings so that we don't have to spend additional money on that remodeling project. I'm really pleased to note also that the pediatric department is expanding its footprint, tiny as they are, into the Clear Lake area. The inpatient pediatric unit for UTMB will open over the next week in the Clear Lake campus. along with a pediatric emergency room. These will facilitate the seeing of patients in both these fine new facilities with around-the-clock supervision of hospitalists, as well as highly trained and skilled pediatric nurses. The unit will have its major opening this coming Tuesday with a ribbon cutting. But before that, we are hosting an art and ice cream party for the young talent who drew sketches and art to adorn the walls of the pediatric unit. So we'll be honoring each of these young school children from the Clear Lake area and their parents with a private art showing. That private art showing is not too private since it's open to the entire community. I'm also pleased to share with you some happenings at our Angleton, Danbury, and League City campuses. We have had extraordinary productivity and community responses to a number of changes in the Angleton Danbury campus. We now have some 20 new physicians there, including a obstetrical and gynecology service that is bringing to life many new families in the Angleton Danbury area. We also have a lot of surgery going on for orthopedics, general surgery, and those kinds of cases, with more on the way. We have full-time cardiologists and additional services also in the specialty area in the Angleton Danbury campus. We've sort of hit the reset button on our League City campus and renovated it in many ways. It is no longer an obstetrics facility for the birth of new folks in the League City area, but it is now a med-surg facility with a focus on our MD Anderson relationship with surgical oncology and cancer treatment. That relationship continues to blossom with more collaborations across the campus, including a new contract related to hospital use and operating room use. We have sought out some creative solutions in our correctional health care program, also in Hospital Galveston, in order to care for an increasing number of fragile elderly patients who are seeking care that requires infirmary beds. By the end of this next month, we will have opened 24 additional infirmary beds in the Hospital Galveston facility, and we are also doing some facilities in existing TDCJ facilities to accommodate the large need we have for a growing elderly population. I do want to recognize today a special group of people and tout their accomplishments, which are many, and that is our researchers here at UTMB. At this particular time, we have many challenging emerging infections that dominate the news media every day. The latest, of course, is the pandemic of coronavirus that is challenging both the health and economic welfare of the entire world. Just yesterday, our scientists in the Galveston National Lab received their first authentic and certified specimens of the coronavirus to begin their search for a potential cure and also for a vaccine. Our scientists have been leading the attack on other things that you will recognize, such as Zika and also Ebola. In fact, earlier last year, our scientists were able to respond to the new strain of Ebola that emerged in Africa by having the specimen received on day 1, and by day 2, having the entire DNA sequence ready to go on a platform to prepare a vaccine, having a vaccine ready to go within 48 hours, and then by having the vaccine shipped to Africa within that 72-hour period of a critical time to apply to the population. And it worked. We have incredible men and women in our laboratories, incredible graduate students, incredible teams of people in our research here that are completely challenging the very limits of the imagination. So when you're thinking about UTMB, don't just focus only on our educational programs, which are stellar, or on our laudable programs in the clinical enterprise. Remember that our research faculty and staff, some 1,000 strong, make up an incredible group of people who are contributing to the growth of our knowledge that enables us to take things from the laboratory literally to the bedside of patients in that translational format to make life better for those around us. I'd also like just to tout the achievements that we are seeing in education at UTMB. The admissions committee for the next class will be finishing its work in the next couple of weeks. I'm told early that we have the largest number of number one choices of any that we have had in the past many, many years. Simply put, that means more students are interviewing at UTMB and ranking UTMB as their number one choice for medical school matriculation. That's something to be really proud of, and something that's a real feather in the cap of both our facilities and our faculty. Thank you for everything you do on a daily basis to advance UTMB's mission to improve health. I'm grateful to each and every one of you for the job that you do. Never, never, never think that your job is unimportant. It is.
UTMB Health, working together to work wonders.